Let's get some good news here, please. Let's talk about the people who are helping and saving lives, and on top of that, saving souls. Beautiful news from some beautiful people in Italy. I want to go to Kelly Seitz, who is a nurse at Samaritans Purse. This is also the same group, Samaritans Purse, who set up that field hospital in Central Park in New York City. But Kelly's in Italy. Kelly, how are you?
Hi, we're good, thank you.
So good to talk to you. Thank you for serving and for loving people. It's beautiful. Let's, real quick, what is Samaritan's Purse? Give us the quick rundown and big picture. What is Samaritan's Purse? What's their mission?
So Samaritans Purse landed in northern Italy on March 17th on our DC-8, and we brought a 68-bed emergency field hospital converted to a respiratory care unit. So we're partnered with the very large hospital. We're in their parking lot. It's a 500-bed hospital. They have 500 COVID patients right now. So we came with our 68 beds to help supplement them and help them with the overflow patients. We have an intensive care unit with ventilators.
I'm sorry, I was just going to say, their hospital's totally full. You said it's a 500-bed hospital and they have 500 COVID patients.
Yeah, 500 COVID patients, and 100 of those 500 are medical staff from their hospital who've gotten sick with the disease.
No. Wow. Okay, what are you doing there, Kelly? How did you get connected with Samaritan's Purse?
Well, I've been working with Samaritans Purse since 2009. So we're a disaster assistance response team. So I've deployed all over the world. This is my 19th deployment, ironically with COVID-19. I've deployed 4 times with Ebola and cholera and diphtheria. So this is what we do. We come to disasters to help support and help the community.
Why do you do it?
I do it because Jesus tells us to love our neighbors as ourselves. And you can't look away when you have the power to change and help. So I leave my husband and my 2 kids and deploy for a month or 5 weeks at a time to use my nursing skills for God's glory.
Yeah, so you brought me to tears, Kelly. What is your husband and how old are your kids, and what do you tell them about it, and what do they say about you leaving?
Yeah, so my kids, that I have twins, and they're now 21, but we started this work when they were 11. So it's a great opportunity to bring the world back to them, to give them a broader perspective of what's going on in the world outside of themselves. It's really important to our family to know that God calls us to scary, uncomfortable places sometimes to be able to help. And if we can help, we really should go and sacrifice. It's not a sacrifice for our family, it's a blessing, and it's a family ministry.
Man. Kelly, I've been sitting at home doing nothing. And you're traveling around the world doing amazing work. Man, I'm grateful. Tell us about, so first of all, how are you guys able, let's do the physical first. We'll do physical, emotional, and then spiritual. How are you guys able to have the expertise and the equipment and the professional know-how to provide top-notch, first-class medical care in the first place?
Well, Samaritan's Purse does an amazing job training us. So there's that. We've had great extensive training, especially with the Ebola outbreak. It really set us up for success for things like this because our Ebola training was really up here and as high as you can get with a 90% fatality. So to be able to come here and transfer those skills, it really was an easy transition. But, we're all trained in the U.S. We're here with doctors and nurses from all over the world, mostly from the United States, but also Canada and the UK, Australia, and other places. And we're just so blessed to be here to help.
Slater Crusaders, thanks for watching the first on YouTube. If you want more, like, subscribe. We got plenty.